Thank you, Chairman and members of the committee. I only have 5 minutes, so I'm going to get right to it. Second trimester D&E abortions perform between roughly 14 and 24 weeks of gestation. Your patient today is 17 years old. She's 22 weeks pregnant. Her baby is the length of your hand plus a couple of inches. And she's been feeling her baby kick for the last several weeks, but she's asleep on an operating room table. You walk into that operating room scrubbed and gowned, and after removing laminaria, you introduce a suction catheter into the uterus. This is a 14 French suction catheter. If she were 12 weeks pregnant or less, basically the width of your hand or smaller, you could basically do the entire procedure with this. But babies this big don't fit through catheters this size. After suctioning the amniotic fluid out from around the baby, you introduce an instrument called a Sofer clamp. It's about 13 inches long. It's made of stainless steel. The business end of this clamp is about 2.5 inches long and 1/2 inch wide. There are rows of sharp teeth. This is a grasping instrument, and when it gets a hold of something, it does not let go. A D&E procedure is a blind abortion, so picture yourself introducing this and grabbing anything you can blindly and pull, and I do mean hard, and out pops a leg about that big, which you put down on the table next to you. Reach in again, and pull out an arm about the same length, which you put down on the table next to you. And use this instrument again and again to tear out the spine, the intestines, the heart and lungs. Head on the baby that size is about the size of a large plum. Can't see it, but you've a pretty good idea you've got it if you've got your instrument around something and your fingers are spread about as far as they go. You know you did it right if you crush down on the instrument and white material runs out of the cervix. That was the baby's brains. Then you could pull out skull pieces. And you have a day like I had a lot of times, sometimes a little face comes back and stares back at you. Congratulations, you just successfully performed a second trimester D&E abortion. You just affirmed her right to choose. When we talk about abortions even later, 23 weeks and up, and we're talking up to 35 weeks and essentially all the way to term, the most commonly used procedure at this point is called the mold technique, and I have not done any of these myself, but I can have the abortionists themselves in their clinic describe what we're talking about. Will you please run my video?
The video will be run.
Dr. Boyd, Southwestern Women's Options. How may I help you?
Hi. I was hoping to schedule an abortion.
All right. What was it in your last period?
It was like the middle of May, so like May 15th, probably.
All right, so it looks like we can do this for you, but it is going to be a week-long procedure. So if you're able to come next week, and we start this on the 12th, I'm going to be looking at a fee of $8,000.
Oh.
Now, are you still in your chair?
Oh, just barely.
Just barely. But what you also need to keep in mind is that every week that goes by, the fee goes up by another $1,000.
Well, we get is at your 27 weeks.
Mm-hmm.
Oh, really?
Yep. So you're about a month, actually you're about a month off in how you thought.
Oh, wow.
You were.
To insert the injection, it's going straight into the sac and to the pregnancy, okay? It's bottom down. It'll insert through the baby's bottom, okay?
Okay,
if
so
it's the head down, it'll be inserted through the head, through the cranium. If we can't catch it early enough, which it has happened, if you're feeling pressure, it's moving down or something coming out, the pregnancy coming out, then you'll want to unlock the door to the hotel room, get your cell phone and just sit on the toilet. You don't have to look at anything, you don't have to clean anything up or nothing. Just be on the phone with us, and you could stay on the phone with us until the doctor and nurse get there. Okay?
Oh, good. So just go in the toilet if I'm having leave. Okay.
Mm-hmm. Yeah.
And what if it does come out when I'm on the toilet?
Just, you don't gotta look down. You don't gotta do anything. The doctor and nurse will come take care of it. If you feel like it's too much to see any of it, then do not let yourself look at it.
Okay.
Okay. If you want to cover yourself, even with like a towel or something.
Okay.
Go ahead.
If you're one of those lucky people that has no pain with contractions and all of a sudden you're like, something's coming out, you sit on the toilet
Okay.
and you call us and you unlock the hotel room and we come in and we take care of you.
If I'm on the toilet and it pops out and it's in the toilet, what do I do?
You would just sit there and you would stay there.
Okay.
And you would not move until we come and get you.
Okay, I mean, I don't have to worry about like
You don't have to look at
taking it out or
anything, You don't have
anything?
to clean anything, you don't have to do anything.
Okay,
Yeah.
you will do,
You
okay.
take care of everything.
So for $10,000, a woman 27 weeks pregnant gets to labor alone, unattended, in a hotel room with no one there to watch her vital signs or otherwise attend her. And if her baby delivers into a toilet, her own dead son or daughter, so be it. Thank you.